Hello. Hey girl, how are you? I'm not feeling so great. You know, I got my period, I'm cramping my top, and at the rate I'm bleeding, I'm going to be anemic by the end of the week. That would be awesome. Anything to get rid of this pain. What's the herb you're talking about though? Done why? Okay, that sounds fine. I'm into that herbal stuff anyway, and it's natural, so it shouldn't do any harm, right? Alrighty, I'll see you in a few. Bye.
Good, thanks.
Is that for me?
It is.
Thank you.
No problem. Hopefully it'll help you out.
This has that down fly, right?
Yes.
Alrighty. Hopefully it helps. I need all the help I can get.
Have you studied any yet?
Yeah, I started studying. I'm on the table right now, trying to go over the PowerPoints. How about you?
I have, but I can't seem to retain anything.
I was actually going to make this tea. I've been drinking it, well, I've drank it before. It has ginseng and pink on it, so it can, you know, help brain stimulation.
Oh, that's cool.
Do you want me to make you some?
Yeah.
Okay, that's what I was making myself some too. Alright, so make yourself comfortable and I'll start making it now.
Thank you. So does this really work?
Yeah, I feel like it makes a difference. Here you go. Oh, awesome. Ibuprofen. I need to take some of this. How does it taste? Actually, awesome.
And you're saying it works, right?
Yes.
Can use as much memory retention as I can get.
You're telling me. I did your last test.
Actually, it's over here.
Yeah, likewise.
Alrighty. So, average body temperature on a child.
I don't know. I'm not feeling too good right now.
What's wrong?
I feel like my heart's about to come out of my chest and I feel really dizzy.
Really?
Yeah, I think I just need some water. I'll be right back.
Holy shit, Belkis. Look at your pants.
Oh my god.
What is this?
I don't know.
Come on, hold on. I'm taking you to the hospital. Let's go.
Okay.
You're gonna be okay. Don't worry.
I'm really lightheaded.
It's gonna be okay. I got you. Okay, hold on a second. Hold on. I need to cover up my car. Just take a seat. Just wait there, okay? Don't die on me. I'm coming, Belkis.
hospital room.
Oh my goodness, help, please. She's gonna die.
What's your name, sweetie?
Belkis.
Alright, Belkis. How long has this been going on?
Like, last hour or so? She just started bleeding about 45 minutes ago. Like this.
Wow, she's at 250 beats per minute. Let me go get the doctor. Dr. Keysean, we have a major emergency.
What's going on now?
She's bleeding vaginally all over the place and her heart rate's 250 beats a minute.
Shit, are you serious?
I'm serious.
Help,
Come.
she's not responding. Help me, please. Belkis.
Alright, what's going on? What's going on?
Belkis.
Hey, look up to the defibrillator or something. Come on. Ma'am, you want to come outside for a second? Yeah, I can questions. Alright, so what's been going on today?
Nothing, we were just studying. And I don't know, she started feeling dizzy and lightheaded and her palpitations. And I don't know, she just started bleeding out.
Has she been taking anything today? Like
No, we just
any
did
food?
some teas.
Teas?
Yeah.
What kind of teas?
I gave her some Dong Quai for her menstrual cycle, and she gave me some ginseng and ginkgo because we were studying and it helps you with your mental. And oh, she took something for pain.
Well, she took something for pain?
Yeah.
For the menstrual bleeding pain, or?
Yeah, because of her period, she has really bad cramps. Is she gonna die?
What did she take for her pain, though? Do you know what she took?
I don't know. I think it was most.
Doctor, she's not responding at all at this point. I need help.
Alright,
Oh my God. Belkis.
What do I do?
Alright, come.
What do I do?
Belkis.
Something. Come on. Like.
1, 2, 3, 4, 5, 6,
Belkis,
7,
please.
8,
Belkis,
9.
wake
Come on,
up.
look up the defibrillator, something. Like, let's go. She's dying right now.
Ready?
She's almost dead.
Clear.
Oh, he played tonight. Oh,
1,
yeah.
2.
Game 1. Come on.
There's nothing. Not a pulse, not anything.
Alright, we're gonna just pronounce it dead then.
What do you mean pronounce? Pronounce what?
She died
She's
because of
not
vaginal
responding.
bleeding. Like, all 3 of those herbs interact with ibuprofen. And if you guys were smart enough and knew that you can't be taking everything at one time, then she wouldn't die. Now I'm gonna go watch the Heat game and finish my day on a good note.
Are you
Goodbye.
serious?
What about ethics, Doc?
Oh yeah, 15 up right now. Go Heat!
Belkis. Belkis.
So I'm going to be talking to you guys about 2 herbs that I looked up. The first one is eucalyptus, which is also known as blue gum. It's an aromatic herb that stimulates the system. It's also a decongestant, relaxes spasms, lowers fever, and has some antibiotic properties to it. Some of the things that we use it for is for like bruises. When you get a bruise, you can like rub it on there. Muscular pains, sprains, and it treats and relieves mucus congestion. As far as everybody knows, there's no specified contraindications. The next thing I'm going to talk to you guys about is witch hazel. It's a topical ointment, and it's an astringent herb with slight aromatic properties. The things we use it for is to curb bleeding, reduce inflammation, lessen mucus discharge. They use it for acute diarrhea, varicose veins, hemorrhage, excessive menstruation, skin inflammation, oral hygiene, sprains, bruises, and burns. And some of the contraindications is that it may reduce the absorption of drugs, so be careful.
Hey guys, I'm here to talk to you guys about 2 herbal therapies. They're oregano and dandelion. Oregano, they can be used as oil or spices. They have been scientifically studied and are seen to be effective against treating germs such as E. coli, also for respiratory tract disorders such as coughs, asthma, and bronchitis. Also, they're used for intestinal parasites and for rheumatoid arthritis. Patients that are allergic to Lamaceae are prone to have allergies to oregano as well. They interact with lithium and act as a diuretic and may decrease how the body expels the lithium. And as far as contraindications, they have a possible effect during pregnancy and lactation, but it hasn't been proven to this extent. are dandelions. They're used as teas. Scientific studies have shown that they have been good for PMS, menopause, to increase ovarian hormones, the loss of appetite, for joint pain, to increase urine production, and for digestive tonics to alleviate nausea and stuff like that. Patients that have allergies to ragweed and related plants shouldn't take dandelions, and their interactions with quinolone antibiotics, they are seen to decrease the absorption of these antibiotics. They also interact with lithium as the same way as oregano does, and they also interact with glucuronidated drugs and potassium-sparing diuretics. As for contraindications, it's also with possible pregnancy and lactation, but hasn't been proven yet either.
Today I will be talking to you about lavender. Lavender is used for many reasons, including treatment of anxiety, restlessness, insomnia, depression, headache, upset stomach, and even hair loss. Most common use for lavender is aromatherapy. The scent of the essential oil is said to have a soothing property, or the oil can be diluted with other oils to be applied to the skin. Dried forms of lavender can be used to prepare teas or liquid extracts. There's not enough evidence to support effectiveness in its health uses. However, there are preliminary results that suggest lavender oil mixed with other herbal oils may help prevent hair loss. Other research also suggests that placing 2 to 3 drops of lavender oil on the upper lip may help reduce migraine pain, nausea, and the spread of headache when inhaled. Lavender is safe for most adults and children, but when taken orally, it can cause constipation, headache, and increased appetite. It should also not be used in boys who have not reached puberty because it can interact with the normal hormone levels in their bodies. Like with any herbal therapy, lavender can interact with drugs such as chlorohydrate, sedative medications such as barbiturates, and CNS suppressants. Interactions with these drugs can cause increased sleepiness or drowsiness. So when taking lavender, make sure to talk to your healthcare provider to make sure it doesn't have any interactions with any drugs that you may be taking. Next, I will be talking to you about the acai berry. It is a reddish purple berry used for arthritis, high cholesterol, weight loss, and anti-aging purposes, but is widely marketed more so for the belief in its weight loss capabilities. It comes available in juices, capsules, and tablets. There is no definitive evidence to suggest that the acai berry can help in any health-related purposes that it claims to help, including weight loss. However, studies focusing on the berry's antioxidant properties have shown some promising results. Studies have shown that the berry demonstrates anti-cancer and anti-inflammatory activity. As of right now, there is no evidence or information on potential interactions with other drugs, but this does not mean that it cannot cause any adverse effects or interactions with drugs, so be careful when taking drugs and any herbal therapies.
Today I'm going to be talking to you about chamomile. Chamomile can be used in 2 ways. You can either use it as a tea or as a topical ointment. If you're going to use it topically, you can use it to relieve the symptoms of eczema. As a tea, you can use it to relieve anxiety. It's also a mild sedative, and you can use it to settle your stomach. Side effects from chamomile do include drowsiness, also allergies if you are allergic to any flowers in the daisy family. If you're allergic to celery, ragweed, or marigold, you can also be allergic to chamomile. If you take too much chamomile, it can cause a lot of vomiting. Some risks with chamomile is it does have an anticoagulant property. So if you are going to have surgery, it is recommended to stop taking chamomile 2 weeks before your surgery. The interactions that it has with other medications as well as other herbal remedies, you have anticoagulants, NSAIDs. It interacts with ginkgo biloba, saw palmetto, St. John's wort, and valerian. Now I'm going to speak to you about anise. Anise is commonly used as a tea, and its uses are for menstrual cycle discomfort and abdominal cramping, as well as it settles colics. It also has unproven uses or uses that need more evidence. Those uses are lice, starting a menstrual cycle, increasing breast milk production, increasing the sex drive, scabies, cough, and spasms. Its side effect is that it interacts with a hormone, which is estrogen, and it also interacts with medications such as birth controls containing estrogen, tamoxifen, which is a cancer treatment, as well as any estrogen-sensitive cancers.